So with sympathetic nervous system, you'll see an increased alertness, metabolic rate, muscular abilities. This is going to be your fight or flight mechanism. This is going to kick in when you're like exerting yourself or super stressed, like when you're running from a bear that's trying to eat you, that is. So then you're going to look at your, let's look at your parasympathetic nervous system, which is known as your rest and digest system. So here is me trying to keep it spicy in my life. So we generally talked about the overall physiologic roles for the sympathetic. I'm going to just list some stuff here so you can read over, and I'll do the same for parasympathetic. Next up, let's talk about the length of preganglionic and postganglionic axons and some neurotransmitters. So sympathetic and parasympathetic differ preganglionic and postganglionic. Preganglionic for sympathetic are going to be short, and pre for parasympathetic are going to be long. There is one instance in which sympathetic will be long in the preganglionic, and that is in the innervation of the adrenal medulla. Here you can see the postganglionic of sympathetic are long, generally speaking, and they release norepinephrine and then some ACH too. The sympathetic nervous system releases ACH for sweat glands, and you can remember this because when you run, you start sweating, and that's your sympathetic nervous system being activated. So this next slide is just showing a axon, postganglionic axon going to the sweat glands. And how about a meme? Let's lighten things up here. Dr. Lewis also mentions nitroxidergic synapses, not pictured here, but it's important to remember that these can produce vasodilation in skeletal muscle and brain. Alright, so just remember that the preganglionic for sympathetic are short and the postganglionic are long, and it's primary norepinephrine, but some ACH and some nitroxidergic. Parasympathetic is going to be mainly long preganglionic and then short postganglionic, and it's only ACH. Now we're going to look at the rest of the stuff here for sympathetic nervous system. We'll get into parasympathetic in a bit. The sympathetic nervous system is organized via the thoracolumbar division, which is going to give you a reference frame of T1 to L2. The origin of the preganglionic neurons are going to be found in the lateral gray horn of the spinal cord. And these ganglia there's a lot of them, so I will leave room to talk about that after this. But then you can kind of just see all the effectors here. So you can see the eyes are dilated, the heart rate's increased, bronchioles are dilated, the vascular smooth muscle in the lungs constricts. And I'll list all these out on a table next. So just to review, the anatomical organization is the thoracolumbar region, T1 to L2, and the origin is in the lateral gray horn of the spinal cord. The location of the autonomic ganglia are the superior, middle, and inferior cervical ganglia, which is going to be T1 to T4. Your cervical ganglion is going to be T1 to T6. Your celiac ganglion, T5L2. Superior mesenteric ganglion is the same. Inferior mesenteric ganglion is T10 to L2. I briefly mentioned some of the effectors at the bottom. We'll get into that more later. Here's a picture that shows what level of the cord is the sympathetic nervous system coming from for any given structure. And then here's a table that correlates the level of the spine with the ganglia and shows the innervation to the certain organs. So we'll just click through these and you can read as we go. Okay, now that we've talked about sympathetic, let's do some parasympathetic. The parasympathetic nervous system is organized as the craniosacral division. Its origin of preganglionic neurons is cranial nerve 3, cranial nerve 7, cranial nerve 9, and 10. 3 coming from the Edinger-Westphal nucleus. and 7 coming from the superior salvatory nuclei, and then cranial nerve 10 coming from the dorsal motor nucleus of the vagus. And lastly is your sacral division, which is your S2 to S4. Looking then at the ganglion, you can see that there is an intramural in quotes, and that is because most of these ganglions are terminating near their in-sight destination. So a couple listed here are the ciliary, the pterygopalatine ganglion, the submandibular ganglion, and then this is going to be your otic ganglion here, which Dr. Lewis does not have us learn. But then going back to those origins, you can see that the ciliary is going to be from your Edinger-Westphal nucleus, and then underneath that is your superior salvatory nuclei, which is cranial nerve 7. Then you have your glossopharyngeal nerve and your dorsal motor nucleus of the vagus. So those are kind of where everything is coming from. Taking a look at the postganglionic fibers, you see ciliary is going to constrict the pupils, pterygopalatine is going to increase secretions, submandibular is also going to increase secretions, and then vagus is going to do the bulk of things. So for the cranial part of the craniosacral, we know now that the cranial nerve 3 is derived from the Edinger-Westphal nucleus, cranial nerve 7 from superior salvatory nuclei, cranial nerve 10 from dorsal motor nucleus of the vagus. In addition, your sacral division being S1, S2, and S3. There's a lot of effectors on that table. This kind of helps me put it into perspective better. I won't go over all these individually, but I will kind of go through the ones that have stark contrasts or seemed a bit counterintuitive at first. You can see parasympathetic stimulates arousal, sympathetic stimulates orgasm. The sweat glands and the adrenal glands are solely sympathetic. Also, the parasympathetic causes glycogenesis, whereas the sympathetic causes glycogenolysis, meaning the breakdown of glycogen. The only other one I've found semi-counterintuitive is that the sympathetic nervous system causes your bladder to relax, whereas the parasympathetic causes it to contract. In general, if the parasympathetic is doing one thing, the sympathetic is doing the opposite, and vice versa, because everything is a yin and a yang.